Well, the Affordable Health Care Act isn't faring too well. It's a mess. And, of course, doctors are quitting. They won't take payments. They want cash only, and people are losing their insurance right, left, and center. So it's perfect timing for everybody to think about self-help, preventive maintenance, just like you do for your car. I mean, look at all the places that sell car parts, sell car maintenance materials, change your own oil equipment, do your own brake pads equipment, so you can change your own brake pads. This stuff is endless for cars and for your house. All these various depots around there where you can buy just about everything to repair anything or build and renew anything, remodel your home. Every kind of floor you can think of, wood floors, concrete, rugs, and you can do it all yourself. Why not for you? And so what I'm recommending is that you start a self-help, self-awareness thing. Everybody in your whole family has to be on preventive maintenance. I'm 74. I haven't been to a doctor, with me being the patient, in the last 66 years. I've never been sick in 66 years. I have never in my life been on a prescription medication. And everybody were like me medically, the medical system would be real humble, wouldn't they? Well, there's several types of health insurance you have to be worried about. Number one is for chronic degenerative diseases, diabetes, arthritis, lupus, periodontal disease, macular degeneration, things like dementia. And then there's minor trauma, cuts and bruises and sprains and strains, that kind of stuff. They really don't require a doctor's attention. And then there's emergency room trauma. Well, call 911. You get to the emergency room as quick as you can. You're in a car wreck, 4-3 burns in your body, throwing up blood, that kind of stuff. Go to the hospital in the emergency room. But if you begin to do preventive maintenance, you take the 90 essential nutrients, one healthy start pack per 100 pounds of body weight, before you get sick, before you get pregnant. Start kids out on the 90 essential nutrients before they're conceived, all through the pregnancy they're developed in from the moment they're born. Then when they need something because they've developed some kind of weird disease or have minor trauma, you say, okay, well, we'll take this herb for pain and take these vitamins and vitamin C to speed up the healing. They'll say, oh, okay. I'm saying, oh, no, I better ask my doctor. Well, that means if they say I have to ask my doctor, that means that nobody introduced them to vitamins and minerals and preventative maintenance when they were a kid. Okay, so we have to change that concept. Once you get a hold of the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and these 3 books will teach you how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. That's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Then for minor trauma and preventing problems when the grid goes down, you don't have electricity for a week, and everybody's screaming, help, help, drop food on us. Well, that's where you want the Go Foods, 25-year shelf life, non-GMO. Half of the offerings are gluten-free. And this is good stuff. I mean, I've been eating this stuff now every week, probably 2 or 3 days a week, and I'm excited about the Go Foods. Okay, and then in the book, God Bless America, it teaches you how to deal with all kinds of problems, natural disasters, invasions by aliens from the other planets, aliens from other countries, and so on, how to deal with all this stuff. Okay, minor wounds, colloidal silver, or CM cream for pain. Colloidal silver kills just about anything. You have infection, you put the colloidal silver on it. You can drink it, you can sniff it, you can make a vapor out of it, you can do just about anything with the colloidal silver. Then we have Killer Biotic. It's a blend of 8 herbs that actually kills bugs and also supports your immune system. And then, of course, the book Hell's Kitchen for weight problems, weight loss, gluten intolerance. And then there is Immortality, the book. It teaches you the things you can do at home to add 25 to 50 healthy years to your life. I think every human being has a capacity to live well beyond 200, but you got to be obsessive about it to get there. If you're just sort of going to the grocery store, buying what looks good, squishes nice, smells good, fresh, organic, you're not going to make it. You might only make it in your 60s or 70s, depending on where you live and what's in the soil, where your food is grown. So you need that book, Immortality. We can do it home what the top 20 longevity cultures do. Of course, they have 40 times 100 as we do, and they're all third world illiterate countries, kind of and cultures. These people have no doctors, no clinics, no hospitals, no private government insurance, yet they have 40 times 100 as we do. What are their secrets? We'll get the book Immortality and start practicing this stuff at home. And then everybody people say, well, I'm not really sick. I'm eating well. I don't have any health problems, not even any noisy joints or aches and pains. Get on the Healthy Start Pack, 1 per 100 pounds of body weight per month. If you weigh 75 to 110 pounds, I would take 1 Healthy Start Pack per month. You weigh, say, 135 to 150 pounds, I'd take 1.5 Healthy Start Packs per month. You weigh 160 to 200 pounds, I would take 2 Healthy Start Packs a month, and so on. And this includes kids. Don't forget the kids. They can't live on these dry cereals and juices. They have to have real food, like eggs, meat. I'm not talking about sandwich meat and deli slices. I'm talking about roast beef, okay? And even grilled pork chocks, not fried pork chocks, not ham, because it's got the nitrates and nitrites in it. And, of course, you got to get rid of the salad dressings that have things like trans fats in them, mayonnaise, margarines, cooking oils, fish packed in oils. Listen, you got to start being a detective. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Crusade after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Thought we'd talk a bit about statin drugs, as we've got a CNN headline news story where the headline reads, "Not on cholesterol meds? New guidelines may change that." Say, if you're not on the medicine to lower your cholesterol yet, you might be soon. Apparently, the American College of Cardiology and the American Heart Association have come out with a new guideline on treating cholesterol. They say calling a focus on risk factors rather than just cholesterol levels. The new guidelines could double the amount of people on the medication to lower their cholesterol, according to experts. Dr. Stephen Nesson, he's the chief cardiovascular medicine at the Cleveland Clinic. He says this is an enormous shift in policy as it relates to those who could be treated for high levels of cholesterol. See, the biggest change from the old guidelines, he says, is ignore the numbers. See, for many years, the goal was to get the bad or LDL cholesterol levels below 100. Said those targets have been completely eliminated in the new guidelines, and the threshold for treatment has been eliminated. In their place, the guidelines suggest using specific risk factors to determine who should be treated for with cholesterol-lowering statin drugs. Say among those are 4 questions that they ask to determine the risks. Do you have heart disease? Do you have diabetes type 1 or 2? Do you have a bad cholesterol level more than 190? And is your 10-year risk of a heart attack greater than 7.5%? A little later in the story, they explain how they figure that, according to a Dr. Donald Lloyd Jones. He is with this group. He was part of their committee, and he says, we were able to generate very robust risk equations for both non-Hispanic white men and women, as well as African-American men and women. Those equations factor in age, sex, race, total HDL, good cholesterol levels, blood pressure treatment status, as well as diabetes and current smoking status. Goes on to say, though, they say that if you answered yes to any of these 4 questions, you should be on a statin, and that is period, no questions asked. They say the new drugs could drop cholesterol to extreme lows, and that will help pad the pockets of the doctors that have invested in extended care facilities for Alzheimer's patients and type. What I find funny is that they're going to give you this drug if you have type 1 or 2 diabetes. But they fail to mention that one of the side effects for taking statins is it will give you type 2 diabetes. So it's like eventually they'll have us all on these drugs. Probably it'll be mandated by Obamacare.
Well, also, when you have diabetes, even pre-diabetes, it drives your cholesterol up. It's one of the things that drive your cholesterol up. Low thyroid, hypothyroidism, or early goiter, pre-goiter will actually drive your blood cholesterol up. Normal cholesterol is 220, 270. And, of course, their highs are way too low. They say, 175. They're happy if you get your blood cholesterol down to 90. You're going to get Alzheimer's disease. And as you pointed out, Doug, this is a recipe for creating Alzheimer's disease in everybody in America. The reason why this is happening is the same reason why they changed the blood pressure levels. It used to be the cutoff for high blood pressure is 140 over 90. Well, everybody with just diet and exercise could get their blood pressures down below 140 over 90. So then they lowered it to 121 over 75. That way they could give more blood pressure medication out. And so what they're doing is just increasing the number of people who will be eligible under their criteria. And, of course, here's where people want to take care of themselves. Get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. There's not a single disease that is caused by elevated blood cholesterol, okay? There's not a single disease. Heart attacks, strokes, not caused by elevated blood cholesterol. Flee any doctor who tells you to lower your cholesterol. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's go to Cleveland, Ohio, and Chaz. You're on with Dr. Wallach.
Hello, Chaz.
Hi, Dr.
You're on
Wallach.
the air.
Hi, Dr. Wallach. How are you?
Okay, sir. How can I help you?
I was doing a follow-up call. You told me to call you after the 10th.
Okay.
You were supposed to speak to, I guess, the orthopedic surgeon.
Oh, I did. Yes. Okay, you're the guy who had the congenital defects in the hips.
Mm-hmm.
Okay. He said he does not do that sort of stuff, but he's going to look for somebody who does. Okay? In the meantime, have you been using the Healthy Bone and Joint Pack yet?
No, I haven't been able to get my hands on that yet. What I've been doing, though, I've been fasting to kind of clean out my system. That's all I've been able to do at this point.
Okay.
And sort of just eating a lot of fruit and just eating a lot of raw vegetables.
Okay, well, that's actually going to be a negative because it's going to take all the minerals out of your bones doing what you're doing. Okay?
Really? Okay.
Yeah. And so you need to have a constant stream of minerals and vitamins going into your body to maintain your bones and your joints. Bones and joints are very dynamic. They're like the sand on the beach, and the more waves that come in, different temperatures and stuff, you begin to lose the sand on the beach. Okay? You get hurricanes, you lose a lot of sand on the beach. So if you're exercising and eating a lot of fruit and raw vegetables, you're in trouble. And so I wouldn't recommend you continue that. How many nutrients do you get when you're fasting? None. And so you need some nutrition here. And I would recommend, again, one Healthy Bone and Joint Pack per 100 pounds of body weight. A surgeon can do mechanical things. They can do mechanical things. But they still need to make sure that you get nutrition to your bones, your cartilage, and ligaments and tendons. And with yourself, you have a congenital birth defect. You need some mechanical restructuring so your feet will align properly and so forth. But to maintain the health of these bones after the surgery is done, or before, I'd be doing it before the surgery. Make them healthy so that when you do get the surgery, you'll recover very quickly. But just, fasting and becoming a vegan and essentially is what you're doing, and not supplementing properly, you're putting yourself in a very dangerous position. So I'd recommend you change that. You take the 90 essential nutrients appropriate for body weight, one Healthy Bone and Joint Pack for 100 pounds of body weight, and we're looking for the right guy for you. It takes some time. We'll find him. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to California. And Shannon, you're on with Dr. Wallach.
Well, Shannon, you're on the air.
Hello, Dr. Wallach.
Hi, how can I help you?
Well, we had a cat wander onto our property. He's abandoned. He's an unneutered 10-pound male. And my question for you is regarding vaccinations and neutering this adult cat. What's your opinion on these things?
Well, if you want him to hang around you, I'd go ahead and neuter him. That's just going to keep him from wandering. Every time there's a female screaming out there, hey, I'm looking for a man because she's going into heat, this is going to attract him. But if he's neutered, it won't attract him. He'll stick around the house. He'll be less likely to mark territories inside your house by spraying urine on your furniture and stuff like that, by neutering him. And I would also give him a half a scoop of the Arthrodex every day because it's a 1 scoop or 25 pounds of body weight for cats and dogs, and a 10-pound cat. It's a nice big male. I'd give him a half a scoop. You could even give him a full scoop of the Arthrodex and put in a couple of capsules of the glucogel. You can just open them up and put the powder in his food. And he sounds like he'll make a great pet.
What about vaccines?
Well, vaccines, if he's going to be outside, if he's going to be an outside cat, I'd vaccinate him because, they sniff other cats' urine when they spray for territory and stuff like that. And there's all kinds of infectious leukemia viruses. There's feline distemper and so forth. And I would just go ahead and vaccinate him if he's going to be an outside cat. If he's going to be an inside cat, not necessary.
Okay, and one more question. When we feed him, he has a voracious appetite. He eats like there's no tomorrow.
Mm-hmm. And, of course, he may have been out there on his own for weeks or months, and he is starving nutritionally, not necessarily calorie-wise, and so this is where the Arthrodex is going to slow that down. They have a voracious appetite in the human beings. It's called the munchies, cravings, binge eating. In horses, it's called pica and cribbing when they eat the fences. And this type of behavior is caused by two things. Mineral deficiency is the primary one. And then, of course, if he's the sort of cat that only ate once a month, whether he did eat, he ate a lot. And so he may still be in that mode, and it might take him a while to get through that, okay? Okay, well, we'll be back with more Truth, Justice, and the Longevity Way after these messages. Okay, Doug, let's go to callers.
Well, let's head to Canada. And Ron, you're on with Dr. Wallach.
Well, Ron, you're on the air.
Hello, Dr. Wallach.
Yes, sir. How can I help you?
Yes, mother has mild to moderate dementia. She also takes blood pressure Diovan. Her blood pressure range around between 130/70, 140/80. She also takes Aricept, and because it makes her go to the toilet a lot, diuretic effect, the doctor changed it to Teva-galantamine. That's the only two medicines she takes.
Okay, so she's on Aricept for dementia, and she's on blood pressure meds.
Yes, and her blood pressure ranges between 130, 140/70/80, which is okay.
Okay, and what does she weigh?
She's 137, 138 pounds. Now I set up a plan for her. I need your expert opinion, because they didn't mention what type of dementia, because there is too many. Medical doctor, they don't say. So I set up a two plan for her, either the Healthy Brain and Heart Pack, or Plan B, one Healthy Start Pack, Ultimate Daily Bottle for circulation, de-stress cap because it has the one of the deficient vitamin for dementia, 2 bottles of selenium, and 2 bottles of Smart FX. What's your take on that?
Okay, I missed that one. 2 bottles of selenium and then 2 bottles of what?
2 bottles of selenium, 2 bottles of Smart FX because it has lots of DHA.
Smart FX, yes, very good.
And then de-stress because it has the deficient vitamin for dementia. I believe it's a thiamine.
Mm-hmm. Yes.
And 1 Ultimate Daily bottle, 180 caps.
Okay, yeah.
And plus the 1 Healthy Start Pack with this.
Okay, very good.
Or the first plan, which is the package, Healthy Brain and Heart Pack. Which one is better?
I'd go with the Healthy. In fact, what you picked out was very good. It'll work. And so I would do exactly as you say. Just be sure that she also gets the Ultimate Daily tablets, as you say, and the de-stress and the selenium. And you're covering, and the Smart FX, you're covering all the dementias, and there's nothing that says she can't have all of them. I see people, Ron, with all the dementias. And so it's not unusual for people to get all of them. And of course, Shar, you've seen people who had dementia.
Oh, yeah.
And they get better in a week.
Yes, yep.
And so, and Ron has picked exactly the correct program. I would do exactly that. And, of course, it's equally important. Anytime you have anything going on with the brain, the heart, the lungs, the liver, the kidneys, I would make sure she's on a gluten-free diet, no fried foods, no processed meats or nitrates and nitrites, and no gluten. And this is going to stop the ongoing damage. The thing that the medical doctors forget is the ongoing damage. You have to change the lifestyle, the things that got her into trouble. And, of course, I would get rid of the Aricept. The Europeans looked at Aricept, and they said there's no value to it, and it can cause discomfort with the diarrhea side effect, but there's no value to it. The Europeans looked at it and said there's just nothing positive there. It does nothing for the patients, and they don't waste their time and money giving Aricept. Okay? Okay, Doug, let's go to callers.
Let's head to Santa Cruz, California. And Geneva, you're on with Dr. Wallach.
Hello, Geneva, you're on the air.
Hi, Dr. Wallach.
Hi.
Okay, this is a 55-year-old female who's been diagnosed with fibromyalgia rheumatica. She's been suffering with this for several years, but it's been really bad for the last 2 years. her doctor put her on all kinds of pain medication until she finally said it doesn't work and stopped taking all of it. There are no other health issues, and her weight is 115.
115. Okay, Shar.
Mm-hmm.
This ought to be right up your alley. Okay, pretty close to your weight.
Mm-hmm.
And fibromyalgia rheumatica is kind of a cousin to lupus, is a cousin to fibromyalgia. It's a cousin to arthritis. And so what would you give this woman?
I give her a healthy bone and joint pack.
Okay. And what else would you throw in there?
She needs to get on a gluten-free diet, too.
Yep, I'd do that. Very good. And so, yeah, I'd give her one healthy bone and joint pack, as Shar recommends. And I would also get an extra bottle of the glucogel so she could have 15 glucogel a day. It sounds kind of heavy-handed, but when you say rheumatica, that means that she's having a lot of joint issues, and so we want to give her the right raw materials in large amounts to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between her vertebrae, bone makes bone itself. And so, again, one healthy bone and joint pack, I'd cut the dose in half for each of the products. Give her half a dose of breakfast, half a dose of dinner, and then 15 glucogel a day would be accomplished by the extra bottle of glucogel. And then, of course, you're going to get a bottle of CM cream, which she can apply to any joint that is painful or swollen, has restricted motion. And that CM cream that comes along with the healthy bone and joint pack is going to give her pain relief as well as increase the range of motion. Give us a call every couple of weeks, if you would, please, Geneva, and let us know how Mom is doing. Okay, Doug, let's go to callers.
Let's head to Canada. And Larry, you're on with Dr. Wallach.
Hello, Larry, you're on the air.
Hello, Dr. Wallace. I called here 2 weeks ago about my daughter, Leanne Kleinsasser, that can't walk. She was born with club feet and all these problems, but I couldn't finish. The other day I called, or 2 weeks ago, that she had 3 surgeries already. When she was 7 months old, they did the Achilles cord cut, where they cut her Achilles cord, a clubfoot correction, and they also did a tethered spinal cord release on her.
And how old is she now? How old is she now?
7. She turned 7 in August.
Okay. Yeah, again, these are all surgical procedures. Maybe, and of course I haven't seen her, but may be required because she had congenital birth defects in her joints. Has that improved her ability to walk?
No, she still walks with braces. She's been improving since I'm on the program. Like, to me, her muscles are more firm.
Uh-huh.
And when you go to the chiropractor, he thinks the sciatica is still weak.
Okay, now, how much does she weigh?
She weighs 85 pounds.
Okay, at 85 pounds, let's see if we can't make her muscles stronger. Let's see if we can't make her joints and bones stronger. So, Shar, 85 pounds, regardless of age here, what would you give her for her muscles and joints and bones?
She needs the glucogel and the OsteoFX, so the basically healthy bone and joint pack.
There you go, perfect. The healthy bone and joint pack. At 85 pounds, one of those per month will do for her. And I would give her a half a dose of everything in the pack, breakfast, and a half a dose of everything at dinner. Keep her away from gluten, fried food, processed meats or nitrates and nitrites. Keep her away from oils, anything that's going to inflame those joints. And then call us every 2 weeks, Larry. Don't wait too long. Call us every 2 weeks, and let's see if we can't get her to walk better. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 90 for Life Crusade. And Doug, let's go right to callers.
Let's head back to Santa Cruz, California. And Kevin, you're on with Dr. Wallach.
Oh, Kevin, you're on the air.
Hey, Doc. Hey, my wife developed a problem gallstones in her gallbladder, and they did an MRI on her, and they said that they need to remove her gallbladder.
Okay. How much does your wife weigh?
She weighs about 2 1/4.
Okay. Does she have any skin problems, eczema, dermatitis, psoriasis, or any asthma, chronic respiratory problems?
Yes, she does.
That was a yes?
Yes.
Okay. when you have gallstones, it's actually a liver problem. The gallbladder is always innocent. It's just a bag. The gallstones are formed in the liver. They drop into the gallbladder. And, of course, doctors perceive it as a quick, down and dirty thing. You see the gallbladder, see all the little stones. They removed it, and it's kind of like removing a bone spur. But it's really a liver problem. And so at 220 pounds, how tall is she?
She's about 5'8".
Okay, so she's a tall gal. I'd like to see her at about 175. So she needs to lose about 50 pounds. We can do that pretty easy. But also, let's make her liver healthy. Shar, what would you do for this lady?
Oh, boy. She needs to get on a gluten-free diet, obviously.
Yep.
And her liver, she needs a...
How about selenium?
Oh, yeah, the liver needs selenium. Of course.
That's the organ that they used when they determined that selenium was an essential nutrient was liver.
Think about what pack had the selenium in it, but, okay, she needs to just take it.
Healthy heart and brain pack. I'd go with a healthy heart and brain pack. That's going to give her the selenium. Yep. And at 225 pounds, I'd give her 2 of those, one at breakfast, 1 dose at breakfast, 1 dose at dinner. So 2 healthy heart and brain packs will last her a month. But also... She
needs to take the enzymes, too.
Yep. Oh, absolutely. Gallbladder in a bottle. Very good, very good. And so I'd have her take 1 to 2 of the ultimate enzymes 2 to 5 minutes before each meal, a couple ounces of water. And that's going to replace the gallbladder's ability to drop bile into the intestine when she has a meal. If we need to do that, that'll be 1 to 2 of those. I'd start a big girl. I'd have her take 2 of those ultimate enzymes, the gallbladder in a bottle, 2 to 5 minutes before each meal, a couple ounces of water. And then I would also give her 9 selenium a day, 3 at breakfast, 3 at lunch, 3 at dinner. And how would you speed up her weight loss, Shar?
She could take the ASAP.
There you go.
Also, too, I'll tell you, if she has her gallbladder out, my mother got yellow jaundice when I was a teenager, so she had to have hers out. That was a life-threatening thing, but she could never eat certain foods after that. It ruins you forever. If you can keep your gallbladder, you're better off to keep it.
Yep. And, of course, the gallstones will go away actually slowly, but they will go away over a couple of months when you give the liver all the raw materials to make bile. Gallstones are not calcified like kidney stones. They're actually just almost 100% cholesterol, and they dissolve very easily in the bile. So the more bile the liver makes, the easier and quicker that the gallstones go away. And so that's kind of the approach that we would recommend. Give us a call every couple of weeks if you would, Kevin. Let us know your decisions, and let us know how your wife does. Okay, we only have a moment left here, so Shar, let's give some recommendations. You've seen people with liver problems.
Oh, absolutely. Absolutely.
Yeah, remember Elaine?
Oh, yeah. Her liver was the size of a 50-cent piece, and she had 33 liver stents put in at one at a time.
Yeah, there was 12 liver operations, 32 stents.
Yep.
At Harvard Medical School. And on this essentially the same program, within 3 months' time, she regrew a normal 6-pound liver. She had what was called primary sclerosing cholangitis, which is a form of liver cirrhosis.
Yeah, Walter Payton died from that before he could get his surgery.
Yeah, they were waiting for a liver transplant, and all he had to do was put him on our program, and Walter Payton would still be alive today.
Exactly.
Okay, well, thank you, Shar. Good job. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.